In this third chapter, many situations were presented which were guilty of many things, expressions, and body movements, starting with one of the charges who was the most affected by the attack, suffered by the hospital, which left her in a very important state of trauma. So far, in the last is not being able to return to surgery. Their expression continued to be scared, sad, and desperate, making histories of concern such as repeatedly covering their faces with their hands, touching their hair, looking constantly on the ground. His closest friends, due to his situation, present body language of concerns, making their expressions with frowns, a lot of body movement. Of the medical side, in this chapter, a very impressive uh, impressive cause were presented. A man, after being infected with human papilloma, did not receive treatment, reaching the point where hair was made him look like a tree trunk. The doctor, seeing this case, there expressed themselves in different ways. Some opened their eye in astonishment. Others put their hands to the mouth, even shouted and jumped from the expression. In addition to these, were also some who continued with their professionalism and maintaining their composure, and they did not show inappropriate body language. They continued with their medical topics, accompanying everything with subtly hand movements, with expression and a lot movement in order to accentuate their explanations. The patient presents many types of emotions, for which he presents many expressions and body movements. Many in pain, he looked up, made small jumps, and moved his head. Signs, signs. Due to his situation, moving their moving other limbs was impossible. The patient wife expressed herself in desperate way. He moved her body, her hands, her head a lot, and shouted a lot about how desperate she was because of her situation and her husband.